गुड मॉर्निंग एवरीवन। आज का टॉपिक है ICDS, दैट इज इंटीग्रेटेड चाइल्ड डेवलपमेंट सर्विसेज। It is very important as well as a unique topic. First of all, what is the meaning of integrated? Integrated means it is a combined, coordinated, different part or services together to work as a one system. Combined, combined means so many services including health, nutrition as well as early education. The simple word of integrated, that is a combined, so many services include health, nutrition as well as early education. Introduction of integrated child development services. The Integrated Child Development Services is one of the world's largest and most unique programs for early childhood care and development. It was launched on October 2nd, 1975 by the Government of India under the Ministry of Women and Child Development. It is designed for both preventive and development effort through an integrated package services. ICDS scheme is working at village level in rural area and also in urban as well as tribal areas. ICDS services, it was launched on October 2nd, 1975 by the Government of India under the Ministry of Women and Child Development. ये यूनिक प्रोग्राम है। इसको यूनिक प्रोग्राम इसलिए बोला गया क्योंकि इसके अंदर बहुत सारे ऐसे पर्सन्स को बेनिफिट्स मिलता है। ये बेनिफिट्स जो है वो 0 to 6 years लैक्टेटिंग मदर्स एज वेल एज द वुमेन्स 15 to 45 years एडोलेसेंस गर्ल्स के लिए बेनिफिट्स है। ये प्रोवाइड करता है प्रिवेंटिव एज वेल एज अ प्रमोटिव services. In that include the packages services. Packages services include supplementary nutrition as well as immunization, health checkup, growth monitoring, referral services, preschool as well as a non-formal education. Nutrition and health education include है, इसलिए इसको integrated package services भी बोला जाता है। ICDS स्कीम ये विलेज एज वेल एज रूरल एरिया, अर्बन एरिया एज वेल एज ट्राइबल एरिया में भी ये मोस्टली यूज किया जाता है। Objectives of Integrated Child Development Services. In that, the first one, enhance the nutritional and health status of children is 0 to 6 years. 0 to 6 years के children हैं, उनके nutrition और health status को improve करना है. Second one, lay the foundation for proper psychological, physical and social development of the child. The simple words we can say it is a comprehensive development of the child. Comprehensive developments include the psychological, physical, social, all the development of the child. Third one, reduce the incidence of mortality, morbidity, malnutrition, and school dropout. First, the incidence of mortality or morbidity को reduce करना है. So what is the meaning of mortality? Mortality means it is a refers to the death rate within the population. And then what is the morbidity? The morbidity it is a refers to the incidence of illness or diseases like malnutrition, diarrhea, respiratory infections, anemia, that all the illness or diseases that happen in the mostly children. Then fourth point, achieve effective coordination of policy and implementation among the various departments to promote child development. ICTs की जो पॉलिसी है उसको इम्प्लीमेंट करना है वेरियस डिपार्टमेंट में एज वेल एज टू प्रमोट द चाइल्ड डेवलपमेंट. Then last one, enhance the capability of mothers to look after the normal health and nutrition needs of the child through proper nutrition and health education. In that, the last one, we can promote the normal health of the mother as well as the child, as well as we can provide the proper nutrition and health education to both of them. Services, 6 services provided under the Integrated Child Development Services. In that include first one, supplementary nutrition, second one, immunization, third one, health checkup, fourth one, referral services, fifth one, preschool non-formal education, and the sixth one, nutrition and health education. That all 6 services provided under the ICDS program. Beneficiaries of Integrated Child Development Services in that include children that is 0 to 6 years, pregnant women, Third one, lactating mothers. Fourth one, adolescents, girls, that is 11 to 18 years. And the last one, women and caregivers. That all the benefits of ICDS group. Package services are provided to different categories of beneficiaries. The first, children 0 to 6 years receive supplementary nutrition, immunization, health checkups, referral services, early childhood care, and education for 3 to 6 years. Second one, the pregnant women provided for services that receive supplementary nutrition, antenatal care support, health and nutritional education, immunization, and referral services. Third one, lactating mothers up to 6 months post delivery. That services include or receive supplementary nutrition, postnatal care support, health and nutrition counseling. Fourth one, adolescents girls, that is 11 to 18 years under schemes like SAG. The SAG, that means the scheme for adolescents girls. In that include services are nutrition support for out of school girls aged 11 to 14, health checkups, life skill education, iron and folic acid supplementation. The last beneficiaries, women and caregivers. In that include services are nutrition and health education, awareness of child care, breastfeeding, hygiene, and family planning. That all the services according to beneficiaries. सर्विसेज इंक्लूडिंग आईसीडीएस प्रोग्राम इन दैट तो जो 6 सर्विसेज है इस 6 सर्विसेज को हम वन बाय वन डील करते हैं ये जो 6 सर्विसेज है इसमें फर्स्ट है सप्लीमेंट्री न्यूट्रिशन इम्यूनाइजेशन हेल्थ चेकअप रेफरल सर्विसेज प्री स्कूल एंड नॉन फॉर्मल एजुकेशन न्यूट्रिशन एंड हेल्थ एजुकेशन इसको हम वन बाय वन डील करते हैं Supplementary nutrition. Supplementary nutrition is a major component of ICDs. It is a bridging the gap between the recommended dietary intake and the actual intake of such a children, pregnant women, and lactating mothers. The children below the age of 6, pregnant women, and lactating mothers receive supplementary feeding or nutrition support for 300 days in a year. Severe malnourished are given special supplementary nutrition and referred to medical services. सप्लीमेंट्री न्यूट्रिशन ये मेजर कंपोनेंट है इंटीग्रेटेड चाइल्ड डेवलपमेंटल सर्विस का ये इसमें जो है वो ईयर पे 300 डेज जो है वो सप्लीमेंट्री फीडिंग और न्यूट्रिशन प्रोवाइड किया जाता है बिलो द एज ऑफ 6 ईयर प्रेग्नेंट वुमेन एंड लैक्टेटिंग मदर्स को जो सीवियर मालनरिश चिल्ड्रन है उनको जो स्पेशल सप्लीमेंट्री न्यूट्रिशन प्रोवाइड किया जाता है और उनको मेडिकल ट्रीटमेंट के लिए रेफर किया जाता है अदर सेंटर या अदर जो है वो हॉस्पिटल्स पे Objectives of supplementary nutrition prevent and reduce the malnutrition among children and mothers, provide the additional nutrition during the early year of life, improve overall growth and development, support nutritional well-being of pregnant and lactating women. Nutritional standards as per Integrated Child Developmental Services guidelines in that the beneficiaries are children 6 months to 3 years, 3 years to 6 years, severe malnourished as well as pregnant women and lactating women. In that the beneficiaries in that the first point children 6 months to 3 years 500 calorie per day 12 to 15 gram per day protein children 3 years to 6 years in that the calorie 500 kilocalorie per day and 12 to 15 gram per day protein severe malnourished calorie 800 calorie per day as well as a protein 20 to 25 gram per day. Pregnant and lactating women require the calorie 600 kilocalorie per day as well as a protein 18 to 20 gram per day. Immunization. Immunization is one of the 6 core services provided under Integrated Child Developmental Services and play an important role in reducing infant and child mortality by protecting children and mothers from preventable diseases. Immunizations of pregnant women and infant protect children from 6 vaccines preventable disease that is poliomyelitis, pertussis, tetanus, tuberculosis, diphtheria and measles to reduce the child mortality disability, as well as the morbidity related malnutrition. The immunization of pregnant women against the tetanus also brings down maternal as well as a neonatal mortality. Health checkup. This include health care of children less than 6 years of age, antenatal mothers, and postnatal care of nursing mothers. First point, जो भी ये हेल्थ चेकअप 0 to 6 year of एज इंक्लूड किया गया है एंटीनेटल मदर्स दैट इज अ प्रेग्नेंट वुमेन्स पोस्टनेटल केयर ऑफ नर्सिंग मदर्स दैट इज अ lactating mothers. Then second one is the various health services provided for children by Anganwadi workers and primary health center staff. जो भी हेल्थ चेकअप है वो प्रोवाइडेड किया गया है चिल्ड्रंस के लिए एज वेल एज द प्रेग्नेंट वुमेन्स के लिए. इट इज प्रोवाइडेड बाय आंगनवाड़ी वर्कर्स एज वेल एज जो पीएसए स्टाफ है, जो हेल्थ केयर पीएसए स्टाफ के जो मेंबर्स है उसके थ्रू ये प्रोवाइड किया जाता है. Third one, the services include regular health checkup regarding weight, immunization, management of malnutrition, treatment of diarrhea, deworming, and distribution of simple medication, etc. Health checkup in that the ICDS program के through proper health checkup, weight, immunization, nutrition, as well as the management of malnutrition, management as well as the treatment of diarrhea, deworming. Deworming means it is one process to giving antiparasitic medications to children as well as the women to eliminate the intestine worms because it affects the nutrition, health, and growth. In ICDs include referral services. During health checkup and growth monitoring, sick or malnourished children need of immediate medical attention are referred to primary health center or its subcenter. The Anganwadi worker has also been trained to detect disability in young children. Sick और malnourished children हैं जो नीडी चिल्ड्रन है उनका ग्रोथ मॉनिटरिंग या हेल्थ चेकअप होने के बाद अगर ऐसे चिल्ड्रन जिसको इमीडिएट मेडिकल ट्रीटमेंट की नीड है तो हम उसमें रेफर करते हैं प्राइमरी हेल्थ सेंटर और सब सेंटर पे. जो आंगनवाड़ी वर्कर्स हैं आईसीडीएस सर्विसेज के इंक्लूड उनको हमको ट्रेंड करना है कि वो इमीडिएट डिटेक्ट कर सके डिसेबिलिटी इन यंग चिल्ड्रन. The next objectives, in that the objectives they ensure the timely medical attention for serious health or nutrition issues, bridge the gap between the community and healthcare system, reduce the mortality, morbidity and malnutrition. Same things here written objectives में we can provide the immediate medical attention, we can provide the immediate care to the serious health issues as well as we can reduce the mortality, morbidity and malnutrition. Then what are the target beneficiaries? The target beneficiaries in that include the children 0 to 6 years with illness, severe malnutrition or disabilities, the pregnant women with complication or high risk pregnancy, as well as lactating mothers with postnatal issues that all included referral services. Non-formal preschool education, that is PSE. Non-formal preschool education is a key component of ICDS. It is the backbone of the ICDS program and its services at providing early childhood care and educations to children aged 3 to 6 years through play-based informal learning at Anganwadi centers for 3 hours a day. जो नॉन फॉर्मल प्री स्कूल एजुकेशन है, फर्स्ट ऑफ ऑल तो प्री स्कूल चिल्ड्रन, द प्री स्कूल चिल्ड्रन हम बोलते हैं 3 to 6 years ऑफ एज ग्रुप को. इसको जो है आईसीडीएस प्रोग्राम्स में अंडर रखा गया है. इट इज अ बैकबोन. जो नॉन फॉर्मल प्री स्कूल एजुकेशन ये बैकबोन है आईसीडीएस प्रोग्राम की. इसमें बहुत सारे सर्विसेज इंक्लूड किया गया है जो अर्ली चाइल्डहुड केयर, एजुकेशन और चिल्ड्रन 3 to 6 years के लिए प्रोवाइड किया गया है. एज वेल एज इसमें और इंक्लूड किया गया है प्ले बेस्ड इनफॉर्मल लर्निंग या इनफॉर्मल लर्निंग या फॉर्मल स्कूलिंग को भी ऐड किया गया है जो आंगनबाड़ी सेंटर पे पर डे 3 आवर्स के लिए इनको प्रोवाइड किया जाता है. दैट इज अ नॉन फॉर्मल प्री स्कूल एजुकेशन. नॉन फॉर्मल प्री स्कूल एजुकेशन के ऑब्जेक्टिव्स है प्रमोट फिजिकल, कॉग्निटिव, इमोशनल एंड सोशल डेवलपमेंट, प्रिपेयर चिल्ड्रन फॉर formal schooling, develop language, creativity, and social skills, reduce school dropout rates. First objective, provide the comprehensive care to all the children like the physical, cognitive, emotional and social development. Second is formal schooling. Formal schooling refers to the structured and organized education providing by organized या recognized schools or colleges as well as a university under the fixed curriculum. Then also develop the language, creativity, and social skills. Then also reduce the school dropout rate. School dropout rate means that is the school dropout is a children or students who leaves school before completing their education at the expected level of age. That all the non-formal preschool education. Nutrition and health education. Nutrition and health education is a process of teaching individuals and communities about healthy eating habits, hygiene practice, disease prevention, and overall well being. It empowers the people to make informed decisions about their diet, lifestyle, and healthcare. इंटीग्रेटेड चाइल्ड डेवलपमेंटल सर्विसेज का ये लास्ट सर्विस है दैट इज न्यूट्रिशन एंड हेल्थ एजुकेशन। न्यूट्रिशन और हेल्थ एजुकेशन जो है हमको टीचिंग प्रोवाइड करना है इंडिविजुअल एज वेल एज कम्युनिटी को अबाउट हेल्दी ईटिंग हैबिट, पर्सनल हाइजीन प्रैक्टिस, डिसीज प्रिवेंशन एंड ओवरऑल हेल्दी लाइफ के लिए। इसमें एज वेल एज हम जो भी पीपल है इंडिविजुअल और कम्युनिटीज को ये भी हम प्रोवाइड करते हैं कंप्लीट इंफॉर्मेशन अबाउट डाइट, लाइफस्टाइल और हेल्थ केयर। Nutritional health education, why it is important for individuals and community because of help prevent malnutrition, anemia, and micronutrient deficiency. Micronutrient deficiency that include the vitamins and minerals promotes healthy growth and development in children, reduce the risk of infectious diseases through better hygiene, increase the maternal health and safe infant feeding practice. That all nutrition and health education. Integrated Child Development Services Team. Integrated Child Development Services Team. The ICDS team refers to the group of personnel responsible for implementing and managing the integrated child development services at various administrative levels in India. ICDS team members are Anganwadi worker, Anganwadi helper, supervisor, child development project officer, district program officer, medical officer, auxiliary nurse midwife, and a last accredited social health activist that all ICDS team. Integrated Child Development Services team members and their roles. At the village or community level, Anganwadi centers, that is AWC, in that Anganwadi worker and Anganwadi helper. Anganwadi worker, the main role, frontline worker of integrated child development services, delivers nutrition, preschool education, and health related services, conducts home visit, and maintains record of beneficiaries. Second, Anganwadi helper AWH assists the Anganwadi worker in daily functioning of the Anganwadi center, helps in cooking and serving meals, cleaning and engaging with children and mothers. At the sector level, supervisor को मुख्य सेविका भी बोला गया है, supervises around 20 to 25 Anganwadi workers, conducts a regular visits to Anganwadi centers to monitor service delivery, provides on-the-job support and report to Child Development Project Officer. सुपरवाइजर को मुख्य सेविका भी बोला गया है। ये 20 to 25 आंगनवाड़ी जो वर्कर्स हैं उनको वो सुपरवाइज करते हैं एज वेल एज ये विजिट करते हैं आंगनवाड़ी सेंटर्स को, वहाँ के जो सर्विसेज है उसको जो है वो मॉनिटर किया जाता है और सारा रिपोर्ट जो है वो चाइल्ड डेवलपमेंट प्रोजेक्ट ऑफिसर को भी प्रोवाइड करते हैं। दैट इज अ सुपरवाइजर या मुख्य सेविका। प्रोजेक्ट लेवल या ब्लॉक लेवल पे चाइल्ड डेवलपमेंट प्रोजेक्ट ऑफिसर होते हैं। जो चाइल्ड डेवलपमेंट प्रोजेक्ट ऑफिसर है, इट इज ओवरऑल इन चार्ज ऑफ ICDS प्रोजेक्ट, responsible for planning, implementation, monitoring, and evaluation. Coordinate with health, education, and rural development department. ICDS प्रोजेक्ट की ओवरऑल इंचार्ज होते हैं चाइल्ड डेवलपमेंट प्रोजेक्ट ऑफिसर। इनकी रिस्पॉन्सिबिलिटी रहती है द प्लानिंग, इम्प्लीमेंटेशन, मॉनिटरिंग एंड इवेल्युएशन ऑफ प्रोजेक्ट एज वेल एज ये कोऑर्डिनेट करते हैं हेल्थ, एजुकेशन एंड रूरल डेवलपमेंट डिपार्टमेंट के साथ। District level, district program officer oversees multiple ICDS project in the district, report to the state level authorities, oversees multiple ICDS प्रोजेक्ट को डिस्ट्रिक्ट लेवल पे जो देखते हैं दैट इज अ डिस्ट्रिक्ट प्रोग्राम ऑफिसर, और रिपोर्ट करते हैं स्टेट लेवल अथॉरिटीज को। एट द सेक्टर लेवल सुपरवाइजर होते हैं, सुपरवाइजर को मुख्य सेविका भी बोला गया है, जो सुपरवाइज करते हैं 20 to 25 आंगनवाड़ी वर्कर्स को, और सारा रिपोर्ट जो है वो चाइल्ड डेवलपमेंट प्रोजेक्ट ऑफिसर को प्रोवाइड करते हैं। प्रोजेक्ट लेवल या ब्लॉक लेवल में, प्रोजेक्ट और ब्लॉक लेवल में चाइल्ड डेवलपमेंट प्रोजेक्ट ऑफिसर होते हैं जो ओवरऑल इंचार्ज रहते हैं आईसीडीएस प्रोजेक्ट के। देन डिस्ट्रिक्ट लेवल में डिस्ट्रिक्ट प्रोग्राम ऑफिसर होते हैं जो ओवरसी मल्टीपल आईसीडीएस प्रोजेक्ट है डिस्ट्रिक्ट लेवल में, उसे वो देखते हैं और रिपोर्ट जो है वो स्टेट लेवल अथॉरिटीज को प्रोवाइड करते हैं। एट द स्टेट एंड नेशनल लेवल्स, स्टेट प्रोग्राम ऑफिसर दैट इज एसपीओ oversees implementation of integrated child development services in the entire state, coordinate with district authorities and national ministry, prepare state-specific plan, policies and monitoring system. स्टेट लेवल में स्टेट प्रोग्राम ऑफिसर्स होते हैं जो कि ओवरसी इम्प्लीमेंटेशन देखते हैं आईसीडीएस इन एंटायर स्टेट में, एज वेल एज कोऑर्डिनेट करते हैं डिस्ट्रिक्ट अथॉरिटीज और नेशनल मिनिस्ट्री को। Then Ministry of Women's and Child Development, Government of India. In that include nodal agency at the national level, provides policy direction, funding, training and overall guidance. नेशनल लेवल पे मिनिस्ट्री ऑफ विमेंस एंड चाइल्ड डेवलपमेंट गवर्नमेंट ऑफ इंडिया है। ये नोडल एजेंसीज होते हैं नेशनल लेवल पे जो प्रोवाइड करते हैं पॉलिसी डायरेक्शन, फंड, ट्रेनिंग एज वेल एज ओवरऑल गाइडेंस रिलेटेड टू आईसीडीएस स्कीम।